Good afternoon, everybody.
Good
Hi,
afternoon, Lisa. Oh, sorry, Barb.
that's okay. This is Barbara Wash from the Department of Medicaid Services, and I have 259, and I'm still clearing the waiting room.
Okay.
Hey, Barbara, this is Erin. Would you do me a small favor?
Sure,
Could you make the agenda just a little bit bigger?
sure.
Thank you. I'm blind.
Is that better?
Yes, ma'am. Thank you.
Okay.
And right now, all I see on here from the TAC is Lisa, myself, that is, and Eva. Is that correct? I don't see anybody else. Do you, Eva? Oh, you're muted. Yeah.
Sorry about that. No, I do not.
Okay. Hopefully we'll have enough show up to qualify as a quorum.
It's 3:01. Do you all want to give it a few more minutes?
Um, I'll tell you what, we don't have a quorum. If we do develop one, we will go back and approve the minutes.
Okay.
But I don't want to waste anyone's valuable time, and we appreciate the time that it takes because we know how it is to be busy and take time out of your day and your schedule. Boy, this camera's off. To be a part of our group, and we do appreciate and respect that. So we're going to go ahead and begin with our agenda.
Okay.
So that we'll just go ahead and proceed. And again, thank you all for being here. I'm Lisa Lockhart, the chair, if any of you haven't met me. And Eva Stone, Dr. Stone, is one of our biggest contributing members of our TAC. She's amazing every time comes through. And the questions on here really came from Dr. Stone. So let's see, do we have any old business other than the minutes? I want to just refresh my memory here a little bit. Were there any outstanding reports or anything that was left hanging out there from our last meeting? It seems like it's been forever ago since we met last.
Hi, Lisa. This is Erin with the Department of Medicaid. I was going back when I saw that and reviewed our May follow-up meeting minutes. And according to that, in the August meeting, you guys were going to request a report for enrollment figures and trends observed from April to April as a result of unwinding. But then you guys canceled your August meeting.
So
So
that's
if you
still hanging out there.
that request has not actually been made since you didn't have your August
Oh,
meeting. So
okay.
if we get a quorum later, that could, well, I don't think you have to have a quorum to
I don't
request
think we need
data.
a
So
quorum for
you
that. I
don't.
think we would like to go ahead and submit that request. Do you want to make any changes to the request? Eva, I saw you came off mute there. Do you got
No.
Would you
anything you
like me
want to
to
add?
reread the data request?
That'd be
Please,
fine.
Okay.
yes.
What I had is a request for report enrollment figures and any trends observed from April 2024 to April 2025 as a result of unwinding.
So can we amend that to, because it was just through April 2025, but since unwinding
Bring it
started
today.
in July, can we make it through the end of November. Or at least through
So
today's date.
Yeah, to get us through to current, right?
what we could do, Barbara, if you could make note, is we could request that through, I would say the end of October, and or we could put in a request in December to get November. I'm not sure. I don't know. Are any of my data folks on mid-month unwinding figures? If that, I would assume that would kind of be a month pure for the better reporting numbers. Your all's discretion.
If we move it to the end of November, it just means you would submit it
And a
in
couple, yeah,
December, but we would still have it ahead of our next, with our, whenever it's finished, right? Which would be ahead of our next meeting.
yes, ma'am.
Okay, then that's what I
And we would, with the
suggest.
holidays, request a few extra days on that.
Understood. Lisa, are you okay with that?
I'm fine with that.
Okay.
So let's see, because we're on a quarterly. So November, December, January, February is when we meet again. If we stay quarterly like we've been.
So your upcoming 2026 meeting dates, I have 2/19, 5/14, 8/13, and 11/19. And I will send those to you today after the meeting.
Okay, perfect.
Mhm.
Barbara, I'll get with you about my notes from the May meeting for data request, and we'll work on that tomorrow.
Thank you so much.
Thanks, you all.
Thank you. Was there any other follow-ups from any of the MCOs? We know the data requests we've got. I'll take that as a no. So we'll move on to new business then. DMS, Medicaid renewals, how are they going with pediatrics?
And that question actually may be tied mostly to the data request. But if
Yeah.
anybody has any updates, just anecdotally, we'd love to hear them.
Okay, can we tie this into data requests for our next, please?
That's
Okay,
perfect.
perfect. Okay, so we'll go ahead and move forward. Oh, thank you, Barbara. Again, for DMS, status of the updated school board technical assistance guide. Ooh, my phone just started, my watch started talking to me. Sorry. Scared me because it was right up in my ear. So updates from the managed care organizations regarding member enrollment figures. Again, that's really another data request, right? I mean,
Actually, that paragraph under number 2 goes with
That's exactly
that.
what I just read off a little bit ago.
Yeah, yeah,
yeah, that's an error, and
yeah.
that would be my fault because I should have caught that. I did that, and I should have caught that.
Number 2 is just, I think, I believe DMS has submitted the updated school-based technical assistance guide to
Yeah,
KDE
see,
for
it got
review.
duplicated, didn't it? Do you see number 3 is the same thing?
Gotcha.
But it got duplicated on the agenda. That was an accident on my part. Please forgive me.
Well, I didn't see it either, Lisa. I'm sorry.
Oh, okay. But anyway, we're rolling that into the other request. So we've already had that conversation. This is moving along very quickly.
Well, now Lisa, with number 2 there though, that's different. That is, DMS has updated the school-based technical assistance guide, and I think that's been sent to Department of Education for review. I just wondered if there's any updates on that being posted and shared out.
You're the expert on that, not I. Okay. Do we have any feedback from anyone?
I thought that might have been Erica Jones. Is she on?
Mhm.
This is Erica. That is with leadership. We should have a decision soon on when it will be released.
Hi, Erica.
Hi, Dr. Stone.
Thank you.
You're welcome.
Okay, thank you, Erica. MCO, request an update from the MCOs on population vaccination rates and what outreach is being done.
And that's probably going to have to be a request for presentations next meeting. Is that right, Erin?
Yes, ma'am. And what I can get with Barb tomorrow, and we will make that a formal request to the MCOs.
Okay.
Would you be able to tell me how you would like that data broken down? Is it region, age group? Is there a certain way you'd like to see that data so we can put that in their request?
I think age group would be
Okay.
really good.
And do you want data or would you like a presentation?
I'd love to hear from the MCOs, what they're doing as far as outreach. This is just me, so Lisa, you may say
No,
something.
I think it's always good when we hear from them. It's interesting. I always learn a lot when they do their presentations.
This will help us communicate just from a nursing perspective
Mhm.
with nursing groups about what is being done around the state and you know
And we
how we
always share
support
back
that.
with K&A so that
Mhm.
they can share with the board and. All right. Well, I'm going to reach out to our MCOs. Do you all have anything you want to share with us?
Where's Stuart? He usually has something to share.
You all are quiet, quiet,
To
quiet.
be honest, I think Stuart may have been reassigned. I've not seen him on some tax recently, so I'm not sure. Is there anybody else from WellCare? We can start calling on folks.
That would be fine with me. I'm looking through and see what I can see here.
Is there
Hi,
anybody
this
from
is,
Aetna on? Oh,
oh, I'm
there's
sorry.
somebody. Nope, you're good.
Yeah,
There's a
hey,
somebody.
hi, it's Suzanne. I'm from United Healthcare. Um, if you could tell me more of what you're looking for as far as an update, what would you like to hear about? That would be very helpful.
What's new, what's going on. There's been a lot of changes. Healthcare organizations and anyone who has any funding related to healthcare, to any processes they have going on, are learning to be very nimble right now and looking diligently and very deliberately at how they manage their programs and their outreach. And I'm just curious how you all are responding to the changing climate because we're not really sure where we are. I think there's a lot of confusion, and I know that confusion, anyone who is in the business of caring for other human beings is trying to figure out what to do. Do they do something? Do they not do something? And you all are
Yeah,
hugely affected by that chatter and bills that are being passed. And I'm just wondering how you're managing.
yeah. Okay. So what I can say is we're staying the course right now. We're keeping our eyes laser focused on our population initiatives, working on, things like mobile mammogram units. We're looking at vaccinations and vaccine reminders and doing outreach on breast cancer screenings and really focusing in around our gaps in care for our members. We have strong CHW teams at United, and so we do a ton of outreach to close gaps in care like social needs screenings. What else do we do? A lot of outreach, especially like in terms of our members with chronic health conditions, engaging members in our programs, again, focusing on those social needs and looking at things like, our value added benefits, especially this time of year. We're always looking for what we can do for our members, where we see gaps, and then what we can do to help with that. So, we're always looking at things like food, transportation, and housing. Those are the top three, the big three that we see the most of. So we're focused on, addressing and working through, different clinical initiatives to try to help with that. So like one of the things that we implemented this year was for anybody enrolled in our case management program, we have the ability to provide like a $25 reloadable gift card for every time that they complete an assessment or a care goal, or another activity like a vaccination or a screening of some type. And so, again, trying to influence healthy behaviors. And then we're able to do that up to $100 in a year for that member. And that's certainly been a big help with our team and like engagement rates and keeping people engaged in the program, really starting to see folks becoming more driven in their healthy behaviors. We've tried to look at making sure that the tools that we have help influence not only healthy behaviors, but then also can help bridge a gap. And so food insecurity has been a huge issue, as you all know, here recently. So again, being able to have that available for our members, especially the most vulnerable members in our complex and chronic condition programs, being able to do things like that. So that's a lot of what, we're just staying laser focused on what we know our initiatives, and our goals are for this year, and trying to make sure that we're doing all those things to support our population, and again, understanding where those gaps are and where we need to focus, like bringing a mobile mammogram unit into an area where we know it's really hard to get health screenings done. Maybe there's a healthcare desert there, or we're just trying to focus in more on the population of those who haven't had a mammogram in a particular region or location. And so those are the types of things that we've been doing. Is that helpful?
It is helpful, but
Okay.
I do have another question, because and some of the data requests are around vaccines.
Yeah.
Are you finding there's always questions, especially when you're talking about peds and worried parents. Are you finding you've got to be seeing like an increase in questions, an increase in safety concerns? I know you can't give us specific data, but I think you probably have a feel for what because there's a lot of confusion around vaccines and vaccine safety and efficacy. And a lot, I mean, it's on the news almost every night.
Yeah, so we just try to provide the education and information that we have available. We also refer people back to their pediatrician or their primary care physician for more information. But that's all we can do at this point, right? Is to provide the education. Here's the information that we have, that we know. And your doctor is the one who should be having that conversation with you, and you should be asking those questions. But we also have the ability, we have nurses on our team who can do that education, and our nurses are great at talking to people about this, but we don't have enough nurses to talk to our whole population, obviously. So, we do have great community healthcare workers, and they are so awesome at talking to people out in the community, going to community events, providing education. We have, different flyers that we have when we're at a community event that we try to provide. And so, I think that, our goal is to educate first, and then help people know where to find that information to answer their questions, always directing back to the provider as the main source to go to ask their questions and whether or not it's right for them, and help them with decision making. Your provider is supposed to be your partner there, so we try to support that relationship, and that's really our focus.
Okay, great. Thank you, Susan. Anyone else have anything to add to that?
Thank you.
Wow, this is going to be one of our fastest meetings ever, I think. But we have a wealth of data coming our way in February.
Oh, we do, and we'll have a quorum, I hope, the next
Yes.
time, and we can, yeah.
Oh, I'm so sorry you all took time out of your day to join us today, and it's such a quick meeting. I mean, sorry, not sorry. You're probably grateful to get 45 minutes to an hour of your time back. But I do appreciate the fact that you blocked off your calendar for us and gave us your time. And respectfully, I'm going to give you your time back, unless there's an objection or anything that needs to be added. And it sounds like our next meeting is Valentine's Day,
The
Yeah,
the
19th.
19th. Okay, I wrote the
19th.
14th
Yeah.
down. Okay.
I'll send those dates to you both.
Okay. All right.
Mhm.
Perfect. All right. If there's no objections, then I'm going to give everybody their afternoon back. Thank you. And happy Thanksgiving. Happy holidays to all of you. Please have a safe holiday season. And thank you for everything you do for the patients, the people in Kentucky. It's very appreciated.
Yep. Thank you all.
Thank you
Thank
both.
you.
And same appreciation to you too.
Yes.
Thank you.
Thank
We'll
you.
see you next year.
Okay. Bye.
Bye.
Bye.